Hello friends, today we are going to discuss why there is plateau phase in the cardiac myocyte but not in the skeletal muscle. As you all know, the cardiac muscles and skeletal muscle both contracts, so there is generation of action potential. So why there is prolonged action potential in the cardiac myocytes? Well, there is two major difference between the cardiac muscle and skeletal muscle membrane property. First, come to skeletal muscle. As you can see, there is a channel which is called first sodium channel. When these channels are opened, there is rapid influx of sodium ion through the channel, and as a result of sodium influx, there is rapid rise in the membrane potential from negative to positive. We also know that there are some channels in the membrane of the cells which are known as open potassium channel. Through this channel, the potassium are getting out, and this is known as potassium efflux. And as a result of potassium efflux, there is rapid decline in the membrane potential from positive to negative. So there are two main lines. As a result of sodium influx, there is rapid rise in the membrane potential, and as a result of potassium efflux, there is rapid fall in the membrane potential. So there is no intermediate phase to hold the action potential. Now come to cardiac myocytes. As you can see in the cardiac myocytes, there are two types of ion channels. First one is first sodium channel, and second one is slow calcium channel. We call this slow channel because they are slow to open and slow to close. First sodium channels are similar to the skeletal muscle sodium channels. When these channels are open, there is rapid influx of sodium from the extracellular space to the intracellular space, and as a result of sodium influx, there is rapid rise in the membrane potential from minus 85 millivolt to minus 50 millivolt. And when this minus 50 millivolt membrane potential is achieved, there is activation of slow calcium channel, and this slow calcium channel and first sodium channel further contribute to the rise of membrane potential to plus 20 millivolt. And when this plus 20 millivolt membrane potential is achieved, there is closure of the sodium channel, and there is no further influx of sodium into the cell. But as we discussed, the slow calcium channels are slow to open and slow to close. These channels are not closed immediately, and there is further influx of calcium into the cell. Similar here, there are some potassium channels in the cell membrane through which the potassium are getting out. We call that potassium efflux. And as a result of potassium efflux, there should be a rapid decline in the membrane potential. But as we discussed, there is also concomitant influx of calcium into the cell. So there is a holding period between the rise and the fall of the membrane potential. The second major difference is in the potassium channel. The potassium channel which are present in the skeletal muscle are more permeable. The permeability here is more than the cardiac muscle. As a result, the potassium are getting out more easily from the cell, and potassiums are getting out from the cardiac myocyte poorly. So there is no rapid decline in the membrane potential, and as a result, there is an intermediary phase which is holding the action potential, and this is called the plateau phase. Thanks for watching.